Good evening, class. Today we will be speaking about heart disease and stroke, the risk factors, the signs and symptoms, and what you yourself can do in the event of a stroke. Okay, what is heart disease? Heart disease can describe a range of conditions that affect your heart. Another term for this is cardiovascular disease. Cardiovascular disease generally refers to conditions that involve narrowed or blocked blood vessels, which can lead to heart attack, chest pain, angina, or stroke. Signs and symptoms of heart disease: chest pain, shortness of breath, pain, numbness in the legs or arms, weakness or lightheadedness, nausea, pain or discomfort in the arm or shoulder. Who is at risk for heart disease? Anyone is at risk for heart disease. Anyone from a child to an adult can get it. Same with having a stroke. Those that have high cholesterol, high blood pressure, diabetes, these are risk factors that can increase your chance for having a heart attack or stroke. What is a stroke? A stroke is a brain attack. It happens in the same way that a heart attack does. It's where a blockage happens in the blood vessels that feed your brain, causing damage in the area from either from a rupture or from a blockage to that blood vessel. This can cause damage to the brain, either small or large, depending on the severity of it. There are two main types of stroke: ischemic and hemorrhagic. Ischemic is when a blood vessel is blocked off, and hemorrhagic is when a blood vessel bursts, leaking into the surrounding tissue in the brain.
They say there's three main types.
There is one other type, and it's called, and I'll get to it, so be patient, young man. Okay, first type, as I said, ischemic stroke, where a part of the blood supply is blocked off and it causes damage to parts of the brain. This can be caused by blood clots that, block off the blood vessels. Hemorrhagic stroke results from a weakened or damaged blood vessels that bleeds into the surrounding brain. It creates pressure, along the blood vessel, causing rupture and damaging the cells and the tissue in the brain. Transischemic attack. It is another type of stroke, but it's a short-term stroke because it doesn't last a long time like a ischemic stroke or hemorrhagic. The effects are temporary. They only last for a limited time. They usually don't last more than, we'll say, 24 hours, I believe. Signs and symptoms of stroke. If you or anyone you know are having sudden numbness or weakness, sudden confusion, difficulty seeing, trouble walking, or sudden severe headache. This can also include difficulty speaking or difficulty with understanding what someone is trying to speak to you. Risk factors of a stroke. There are modifiable and unmodifiable risk factors. A list of the modifiable ones would be high blood pressure, tobacco use, diabetes, keeping your blood sugar under control, your blood cholesterol, keeping that under control to a level that is nominal for your body. Physical inactivity is a risk factor. Poor diet. Obesity, look at me, see, good example of what not to be. Uncontrollable risk factors would be hereditary risk factors, gender, race, previous stroke, and getting older. If you think you're having a stroke, these are things you need to look for. If you see a sudden drooping in your face or someone you're with, arm weakness. Suddenly your arm just doesn't want to work the way it normally should. And difficulty with spoken speech or understanding of speech. you need to call 911 to help get this taken care of. The quicker you act, the quicker someone's life can be saved, the quicker treatment can be given, which will help them in the long run. Okay, best acronym to know to remember the signs and symptoms of a stroke. If you think that any of these symptoms are happening, call 911 first, but these are the symptoms. Facial drooping, it'll be very noticeable. Arm weakness, speech difficulty, time to call 911. F-A-S-T, fast. Get to it. And my references. Now I have a questionnaire for you guys to fill out, and we will go over the questions as soon as you're finished with the answers. You can use the handout that I've given you, as well as conferring amongst yourself. Some are multiple choice. Okay, now class, we're going to do a questionnaire to see how well you learned the information provided. Okay, can anyone name at least 3 signs or symptoms of a stroke?
Face drooping, arm weakness, speech difficulty.
Chest aching.
What? No, that would be heart.
Oh.
Sudden numbness or weakness, face, arm, or leg. Sudden confusion, sudden trouble seeing, sudden trouble walking, or severe headache. List at least 2 modifiable risk factors for heart disease and stroke.
High blood pressure, diabetes.
High cholesterol.
Very good. List at least 2 unmodifiable factors.
Age,
Stroke.
hereditary,
Yeah.
and previous.
Race, previous strokes.
Very good. List the 3 main types of strokes.
The ISC, the TRA,
Ischemic,
and
hemorrhagic,
the H.
ischemic, hemorrhagic, and
Yeah.
TIA.
Thank you.
Yes, that.
Don't mind the other participant. He's lost his mind. List the parts of fast.
Face droop, arm weakness, speech, time to call 911.
Very good. And who is at risk for heart disease and stroke?
Everyone.
Okay. What is a stroke?
Brain attack.
Okay, can anyone tell me what a brain attack is?
You either have a blockage in your brain, as in blood can get through the vessels, or you have a rupture in your vessel and it bursts blood
Very good,
everywhere.
Very good. What is heart disease?
Plaque.
That is one of the risk factors. It relates to any disease
That deals
causes
with
a
the heart.
narrowing of the blood vessels,
Arteries.
which can cause changes in your rhythm, valve problems, or heart muscle issues. If you're eating dinner with someone and you suddenly notice that person's face drooping on one side and they drop their fork, what do you do?
Come on.
Very good. What is an acronym for remembering the signs of stroke?
Fast.
Very good. To spot a stroke, what do you look for? A, facial drooping, B, dilated pupils, C, arm weakness, D, speech difficulty, or E, ACAD. Thank you, class. Why is it important to call 911?
You could die.
The sooner you call, the sooner you can get help for that
Faster you get
person.
treatment, the better.
Very good, very good. The faster you get
All the
treatment, the
above.
faster they can get care. And
The later
Reduce
you call,
the
the
amount of
later they
damage.
die.
what are signs and symptoms of heart disease?
Chest pain,
Yep,
shortness of breath,
yep.
weakness,
Pain, numbness, weakness. Yep.
Speech despair.
That's stroke.
speech is
Well, class, I hope you've learned something today. I hope you can take this home with you and see what I have to deal with, and that you're able to use this in your life. Thank you and have a good day.